Hi, I'm Christopher Gillberg, and together with Abigail Mance and Elaine Clark, I've edited this new book on autism in complex presentations. I'm a senior professor of child and adolescent psychiatry, and I've been working in the field for more than 50 years, both in clinical and research work. And I've met with thousands of families with autism in complex presentations and with families with other kind of neurodevelopmental conditions.
Hello, I'm Abigail Mance. I'm a speech and language therapist and I work in two clinics within the hospital that provide neurodevelopmental assessments and diagnosis. I've over 20 years experience having worked in mainstream and special needs schools and also in a clinic for children who stammer.
Hello, I'm Dr. Elaine Clark and I'm Specialty Lead for Neurodisability at Great Ormond Street Hospital. My experience in this field started as a community paediatrician in the UK before taking up this role as clinical lead for neurodevelopmental assessments. At this tertiary setting, we have the real privilege of providing multidisciplinary team assessments to look at profiles for children where there's a level of complexity and where local teams are asking for a second opinion. The coexistence of neurodevelopmental differences was recognised and shared through the concept of essence in 2010 by Professor Gillberg, who we were really pleased to welcome onto this venture with us. So this started for us between 2016 and 2019, during which time our team offered a series of lectures to help raise awareness among professionals about the importance of recognising and supporting autism, and to share practical advice on how to approach assessments when considering coexisting conditions. So although it's well recognised that neurodevelopmental conditions frequently co-occur, still a diagnosis of autism can be overlooked or difficult to assess in such cases. For example, the social communication and behaviour differences may be interpreted solely in the context of the known condition. Without recognising the diagnosis of autism, individuals and families may miss out on essential information and valuable resources for support. So this book was created to enable the teaching to reach a wider audience to help establish equity of care for all families.
The book in question is called Autism in Complex Presentations, A Guide to Assessment and Diagnosis. The book aims to cover a range of conditions that are commonly seen in practice and known to co-occur with autism. The first chapter sets the scene and considers what's behind the rise in autism. The book is then structured with a chapter for each condition. Conditions include mental health conditions, neurodevelopmental conditions, physical and medical conditions. It also considers the challenges identifying autism in girls and women, gender diversity in autism, maltreatment and autism. We know we've not been able to cover all the relevant topics and conditions, and we aim to expand the content of this book over time. Each chapter summarises the current evidence base relating to the particular condition. It considers why it's important to think about autism as a possible additional diagnosis. Practical guidance is then shared on how to approach assessment and diagnosis, taking the particular condition into account. And then intervention is considered where a dual diagnosis of autism and something else is given. Each chapter concludes by thinking about the priorities for future research. A case example is used in most of the chapters to illustrate a patient's journey or a possible patient's journey through the assessment process.
To our knowledge, this is the first publication in the field that gives a practical basis for assessment beyond standard autism practice, if you will. And the book gives a summary of where we are with evidence on rates of co-occurring conditions and what will be likely to happen in the near future. The book, each chapter is supposed to be and is evidence-based. And the good thing about it is that the chapters in themselves, each chapter is relatively short. So you don't have to, just sit down and for an hour or more with each chapter. You can come through one chapter quite quickly. The book brings together international teams of experts, clinicians and researchers, and in recognizing and assessing autism and children with autism with other coexisting conditions. And in my own experience, if you meet criteria for autism at a young age and you really need help, there's always more than autism. And so the co-occurring conditions very often are at least as important as the autism, and it's essential that they are recognized and intervened for in the best possible way.